So to begin with, the biggest worry for people who are affected is not only the people around you, but doctors. And I mean, I was misdiagnosed multiple times. In fact, I was not even believed, which is why I went back
Yeah.
to India. And I finally met my doctors, Dr. Prashant Mangeshikar and Dr. Abhishek Mangeshikar, who actually, as soon as I went there, at that time, I think I was at my lowest because I was under menopause. So I was very, very low. I was like 27 years old and I was undergoing menopause, and it was like not easy for my body to take that.
You
Uh,
were undergoing menopause, like you had a
Artificial.
hysterectomy?
No,
Oh.
artificial, like,
Oh.
yeah, like progesterone, birth
Oh,
control pills, basically. Yeah.
yeah.
So basically, it was like I went to my doctors and I finally talked up. Like I'm a person who talks a lot, as you can see. But
I'm the same way.
so when I
That's
went,
another endo trait we share.
so when I went there, I was at my lowest. I barely talked. I just gave them my file and I didn't say a word. And they basically asked me like, "How bad is the pain?" And I was like, 10 out of 10. They were like, "You have endometriosis." And I was like so shocked that, I mean, I knew for a long time, but I had no one to vouch for me or no one to say that this is what you have. um, I was just too shocked to like hear the rest of it. But what I'm trying to highlight is that it's very hard to get doctors who actually believe you.
Yeah.
um, and like, what are your thoughts on that? Like, how is that traumatic from the lens of a therapist? Like, what do you think a person undergoes when they have to face those challenges?
Um, well, first I have both sides. As a therapist, I try to see both sides of the picture. And we just don't have the tools right now to be able to diagnose somebody by using like a MRI
Yeah,
or ultrasound machine. Like there's no way to know. Like you can only know if you go inside the
yeah,
person and you see it because it's so fine, this
yeah,
tissue that
yeah,
that is. So I mean that is a challenge in itself. And we live in Canada, and Canada is wonderful because we have the universal health care, but at the same time, um, healthcare is challenging to really convince a doctor that you need a specialist. First of all, is not easy.
yeah,
First of all, getting a doctor is not easy,
yeah.
right? Especially, I remember in BC, it was impossible to find a doctor. And then after you get a doctor, which is really hard to get, then you have to somehow convince them
Yeah,
that you really need a specialist. That's even harder,
yeah,
and that takes even longer.
yeah,
So the wait times and all of that, that's all thing. And then they have to actually put in their reports. They have to justify why they need the specialist, why you need surgery. So it does take effort. And because I'm a clinician, I know that if I need to access a resource or a support for my client, I need to make a case. It's not as simple as, oh, I believe my client and I'm going to go send that person. No, it's not a subjective measure. It's an objective measure,
mm,
meaning you need tons and tons of evidence to support why something has to happen.
yeah,
So they also have to go through those steps
yeah,
to actually push it to the next level for you. But in the same token, for the patient's experience, I always try to tell my clients, you have to also let the clinician know or the doctor know how severe your symptoms are.
yeah.
Like if you minimize it, if you say, yeah, it's okay, I'm managing, and you're trying to be like this
You
tough
don't want to
person.
like make a big deal out of it, basically, right?
Yeah, you don't
Even though
want
it is,
to, seem like you can't handle it and you're being, like that. Then they also can't document that it's severe, because sometimes I ask my clients, from a scale of 0 to 10, 10 being really high and 0 being nothing, where would you rank your level of anxiety or whatever? So same thing, a doctor might ask their patient this, and the patient's like, well, I don't know, I guess it's a 6 or something. Then they're not, you
yeah,
have to be like 10 or
yeah,
like 9 in order for them to actually put this somewhere. So I always encourage clients to self advocate for themselves.
yeah,
It's really on you. The onus is on you. You have to be honest about your pain, and don't be shy.
Yeah.
Because if you are shy and you hold back, it will not be taken into consideration. And then you can't be upset that, well, they didn't really probe and they didn't really look into it. It's your job to convince them, right? But at the same time, it's their job to respect the information you're
Mhm.
providing. So if they just dismiss it and say, well, maybe just take some pills.
Yeah.
And, again, pills are like, pills have their place. I
Yeah.
mean, honestly, all these years, I'm not a big pill person myself, but there are times I've had really bad panic attacks that if I did not have a painkiller, I don't know what I would have done.
Yeah. I know what you mean.
Like, there were days in my life where I had to take it.
Yeah.
There was no choice. I thought I was going to die.
Yeah.
So, there is a place for medication, but it can also be addictive,
Yeah.
and it can also cause other problems. Like, you can have developed liver issues or kidney issues. Um, Sorry,
Something.
my phone battery is starting to go.
Oh, okay. Yeah. You're back on.
Yeah, yeah. I'm just putting the charger in.
Mm-hmm.
Yeah. So I think that from a patient's perspective, also, we don't like to be labeled. Nobody likes to be labeled. I don't want to be seen as somebody who is a disabled person, and that's probably why this is the first time in my life. It was actually last week when I was on mediation station where I shared that I have aniridia
Yeah.
and endometriosis. I never was public on a public forum, like on a newscast before, saying that, because I never wanted to be seen as a victim or
Yeah.
as, oh, poor you, or people having sympathy. I'm not somebody who looks for sympathy.
Yeah.
But at the same time, I felt it was important to share my story so that other people know that
Yeah.
this exists and you can still be a whole person even though you have these problems.
That's true.
People are afraid of being labeled. I
Yeah.
mean, who isn't? Who wants to be labeled?
Yeah.
But I'm more than my disease.
For sure.
It's something I have, but I'm more than that. And that's why even on social media I try to show images of my modeling and things like that, but also intelligent posts, and
Yeah.
also like just like more to show that you can be like 100 different things.
Yeah.
You don't have to be just one note person.
Yeah. So
So
going
it's
back
hard.
to the doctor's talk that I was talking about, in my experience, actually, I was very honest, and I still met 9 doctors who just dismissed it. Yeah, and I
Wow.
went with everything that you're saying, 10 out of 10 pain, and I explained in a biological manner.
Okay.
But I've also heard so many stories similar to mine, and that does a lot to a person's mental health.
Yeah.
It's a big challenge. So I then went on to, like, I went on hikes. I did things that I knew I was physically not capable of at that time. So
Mhm.
these are some of the things that we all have done. I mean, you went for marathon
Yeah,
and all
I
those.
know, because you want to be outside of your body.
Yeah.
You don't want to be living in your body,
Yeah.
because your soul and your spirit is,
Yeah.
I want to get out of this thing. I hate this body. And I started to hate my body, the
Yeah.
body image issue that I suffered, because already when I was younger, I was bullied incredibly.
Mm.
And I always had a weight problem, and I always was self-conscious about my body in the first place.
Mm.
And then on top of that, having endo and
Yeah.
hating my body.
Yeah.
uh, First time in my life I felt good when I was running the marathons and
Yeah.
exercising and all that, is I started actually liking my body.
Yeah.
But I also was not happy having my body,
Yeah.
if it makes sense, especially because of the disease.
Yeah, for sure.
I wanted to ignore it. I wanted to not acknowledge it.
Yeah, it was the same. Like, I went through a few months of hating it and then realizing that I can't hate such a big part of myself.
Yeah,
So
yeah,
that was another challenge. And, like, so I want to also address the elephant in the room, which is COVID-19. So
yes,
basically, there's a lot of people who are waiting on surgeries, especially when they have endometriosis. And I know that for me, the wait time was really less because I was in India. Like I only had to wait
Yeah.
2 weeks, but I just could not stop waiting for those 2 weeks. And what I feel really bad
Yeah.
about is that a lot of people here are affected, and I see those posts every single day that the surgeries that were scheduled a year ago are now postponed indefinitely. And that, I
Yeah.
wonder, like, what's happening? Like, what do you
It's
think
very
happens? Like, how would one
Yeah,
change
it's
this?
terrible. Waiting is horrible. Waiting is so horrible.
Yeah,
And it I don't know. I was fortunate that I was working for the health authority, but even for me, it took a long time to even get, first of all, being taken seriously by the doctor. Then, because I had all my reports of my surgery and all these things, I was able to see a gynecologist right away. And then they're the ones who made a referral to the BC Women's College for me, for getting my surgery with Dr. Catherine Allaire. And I was able to expedite it because I was steward. I with the union, I really advocated for myself
yeah,
to get the surgery as soon as possible because I knew that I had a right to be accommodated at work. And because I've been through this road before, this was my third time and I had planned it. I was able to luckily get my surgery done within 18 months. And that's still good for
you?
the wait time is usually 3 years plus. Sometimes people are waiting 4 years, 5 years. With COVID-19, what can we do? The whole world has stopped.
Yeah,
It's not anything personal. It's not, but I feel bad. My heart goes out for those poor ladies.
yeah,
But all I can say is all you can do right now is try to manage your disease as best as possible. Do whatever you can in your power. If
yeah,
that means, eating an anti-inflammatory diet and, trying to do self-care things to reduce your stress, whatever you can do,
yeah,
at least you can do that. But it sucks. It really sucks.
yeah,
I know, and I'm so sorry that,
yeah.
we'll have to wait right now for their surgery.
And like the level of pain that we both experienced, like waiting for 3 years in that amount of, like, some people have waited for 3 years already now, and now they are having to face this challenge. It's just, yeah,
Yeah, like I wouldn't have had to go through my third surgery if it weren't for the fact that I also have adenomyosis.
yeah,
So adenomyosis is different from endometriosis because it's actually these tissues growing inside the muscle wall on top of it.
yeah.
So you have the tissue pulling the organs away, and then you also have the tissue pulling it in.
I
So
know.
it's like it always felt like a
Tug of
tug of
war.
war, like a
Yeah,
pulling sensation.
yeah,
And it was just like ongoing. And it's like I used to get on top of it because we're just being open and sharing. I had bladder infections all the time, like all the time. And then they sometimes became kidney infections. And, between the infections and having iron deficiency and
yeah,
this thing, it is a nightmare. So when these ladies are describing that having to wait that long for their surgeries, because it's not just about taking one thing out,
yeah.
just to manage on a day to day and month to month basis, we have like off, like every month after my period, I would have a bladder infection, like
Yeah,
all the time. So, and the migraines
yeah,
and this. And so I just decided to end it
yeah.
once and for all by having my hysterectomy. And I promised myself when I turned 40 years old
It's your
that,
birthday gift.
that this would be my birthday gift to myself.
Yeah.
So I'm just grateful